get a look from an industry insider on the bill. Universal Health Services owns and operates acute care hospitals, behavioral health centers, as well as ambulatory centers all across the nation, as well as in Puerto Rico. CEO Alan Miller joins us now. Welcome to Alan. Great to have you with us today. So your share price is at an all-time high here. What's going on with your business that's driving growth to this level?
The business has done well. We had a very good year last year. I think it shows that even in an uncertain environment, we have an excellent management team, been together for a long time, and the people perform. And we have been working on being more efficient. Obviously, it's easier for us to negotiate contracts in this environment. Purchasing, we do better in supplies, equipment. And overall, we have a very good team. We've had a very excellent year.
Now, some of the analysts, as you are probably well aware, said that the first half 2010 forecast might be too high because of, here the thing, tough comparisons. Also because of current levels of unemployment. We know unemployment is elevated to 9.7% in this country. You had bad weather in February and fewer flu patients now that we come out of the season. So what do you think about that assessment?
Well, those are probably things you have to be concerned about. But, I mean, overall, the company's been in business. This is our 30th year. We're adaptable. As I said, a very excellent management group. And we'll adapt to whatever environment comes along.
Boy, that just leads me to my next obvious question. That's obviously healthcare reform. In 30 years, have you ever seen... Obviously, we had Hillary Clinton and her attempt to overhaul healthcare, but what are your thoughts on where we stand right now with this climate and what ultimately will be? How are you setting up the company to prepare for that?
Well, we're not changing anything. We're just being more efficient. I think we had an efficient company to begin with, but you have to be concerned about costs. We are very efficient. We want to maintain a high level of quality, and we will see what comes out of the legislation, if anything, or if this one should not go through as is, then I'm sure there will be other bills that relate to parts of the overall program. If
you're managing your costs, what do you think of some of the health insurers who are blaming the medical device makers and the services providers for having to raising their premiums to assume these higher costs? Is that a fair? And the president, of course, is kind of blaming the health insurers for raising those premiums too high.
It's a complicated area. As everyone knows now, it's 17% of the overall economy. It's very complicated. There's an awful lot of parts. You don't have a $2.4 trillion overall industry without being complicated. So the device manufacturers have things to say. The insurers have something else to say. Demonizing insurers, I don't think, is really a way I would go. There could be reforms, no question about it, but they are 88th as an industry in overall profitability. Their bottom line is 2% net profit. So it's not as if these people are really rolling. I think you can point to anecdotal increases for different reasons, and if you want to use that to make a big case, you can, but I don't think that's terribly fair.
All right, we'll have to leave it there for time considerations. Alan Miller is the chairman and CEO of Universal Health Services. Thanks so much for your time.
Thank you.